1. When developing a NAVLE study curriculum for veterinary graduates, which principle of adult learning should be prioritized to enhance long-term retention? A. Passive lecture delivery. B. Immediate application to clinical scenarios. C. Memorization without context. D. Strict adherence to rote repetition. 2. In evaluating NAVLE readiness, which assessment method best aligns with formative evaluation principles? A. Final comprehensive exam only. E. Case-based practice quizzes with feedback. C. Unstructured peer discussion groups. D. Memorization of textbook summaries. 3. Which of the following best demonstrates curriculum development for NAVLE preparation that follows backward design principles? A. Start with general lectures, then hope for retention. B. Identify exam competencies, then align materials and assessments. C. Allow students to choose topics randomly. D. Focus exclusively on laboratory procedures. 4. A mentor guiding a NAVLE candidate uses the scaffolding technique. This approach primarily involves A. Removing all support to test independence immediately. B. Providing structured support that decreases as competency improves. C. Giving constant, unchanging supervision. D. Assigning only independent reading. 5. When training students to interpret NAVLE-style multiple-choice questions, what communication technique most effectively improves diagnostic reasoning? A. Providing model answers without discussion. B. Encouraging think-aloud problem-solving during practice. C. Limiting students to silent individual study. D. Using only written flashcards. 6. A regulatory compliance requirement for NAVLE preparation programs is ensuring fairness in testing. Which strategy best ensures this? A. Allowing only high-performer students to access resources. B. Randomizing questions and standardizing grading rubrics. C. Offering exams with variable grading standards. D. Using outdated test items with limited availability. 7. In mentoring NAVLE candidates, an effective evaluation method for self-regulated learning includes A. Requiring daily memorization logs. B. Encouraging reflective journals on case-based progress. C. Tracking attendance without skill assessment. D. Assigning ungraded busy work tasks. 8. When aligning NAVLE curriculum with clinical reasoning, which instructional design principle is most effective? A. Start with isolated facts, then slowly integrate clinical relevance. B. Integrate real-world veterinary cases early and consistently. C. Emphasize theoretical knowledge before any clinical link. D. Use only standardized textbook content. 9. Which communication strategy best helps reduce test anxiety during NAVLE preparation? A. Using fear to motivate study habits. E. Providing supportive feedback and relaxation strategies. C. Avoiding all discussion of exam stress. E. Minimizing student-teacher interactions. 10. Which adult learning principle is most critical when tailoring NAVLE review for diverse veterinary specialties? A. Uniform curriculum, regardless of learner goals. B. Emphasis on self-directed and specialty-relevant study pathways. C. Mandatory memorization of all species equally. D. Ignoring learner preferences for clinical emphasis. 11. A NAVLE prep mentor uses simulation labs with standardized patients. This approach primarily supports a rote memorization of drug names. B. Experiential learning through realistic practice. C. Passive note-taking and observation. D. Reducing opportunities for critical thinking. 12. Which curriculum evaluation method ensures continuous improvement in NAVLE preparation programs? A. Summative end-of-course surveys only. B. Ongoing feedback loops with iterative curriculum adjustment. C. No formal evaluation system. D. Faculty-driven decisions without student input. 13. During NAVLE review, an instructor uses case-based group learning. Which mentoring technique does this most closely represent? A. Directive command-based teaching. B. Facilitation of collaborative problem-solving. C. Individual-only assignments. D. Rote repetition of exam answers. 14. When designing NAVLE multiple-choice practice questions, which element ensures validity? A. Alignment with NAVLE blueprint competencies. E. Focus on trivial facts outside test scope. C. Reliance on overly complex wording. D. Writing distractors unrelated to veterinary medicine. 15. In NAVLE-focused adult learning, intrinsic motivation is best encouraged by A. Linking study to professional identity and patient outcomes. B. Rewarding only with external prizes. C. Forcing standardized pace regardless of learner readiness. D. Prohibiting individual goal setting. 16. A faculty team revising NAVLE prep materials ensures compliance with testing regulations by I. Using copyrighted questions without permission. E. Developing original items modeled after official competencies. C. Allowing unproctored sharing of secure test items. D. Ignoring national examination guidelines. 17. Which evaluation method provides the most authentic assessment of NAVLE readiness? A. Case-based OSCE simulations reflecting real clinical encounters. B. Random trivia quizzes on non-clinical topics. C. Peer popularity rankings. D. Attendance tracking without skill testing. 18. In a mentoring relationship for NAVLE candidates, effective feedback should be A. Immediate, specific, and actionable. B. Delayed until the final exam is graded. C. Vague to encourage self-guessing. D. Limited only to positive reinforcement. 19. When teaching NAVLE pharmacology, which curriculum design principle supports deeper understanding? A. Isolated memorization of drug names. B. Integration of drug mechanisms with clinical case application. C. Exclusive focus on side effects without context. D. Separation of pharmacology from diagnostic reasoning. 20. Which adult learning strategy best supports veterinarians returning after years in practice to prepare for NAVLE? A. Rigid, one-size-fits-all memorization drills. B. Flexible, case-based modules automating prior experience. C. Exclusion of their professional insights from study design. D. Exclusive reliance on peer teaching without structure. 21. Which of the following is an example of regulatory compliance in NAVLE prep testing centers? A. Providing equal accommodations for candidates with documented disabilities. B. Restricting access to materials based on gender. C. Using inconsistent proctoring procedures. D. Failing to secure exam content from unauthorized use. 22. A NAVLE preparation mentor helps a candidate identify personal weaknesses through structured reflection. This practice demonstrates A. Summative-only evaluation. B. Self-assessment and metacognitive skill building. C. Avoidance of learner input. D. Emphasis solely on mentor authority. 23. When analyzing NAVLE test results, program directors should use evaluation data to A. Modify curriculum content and delivery for better outcomes. B. Ignore results since they reflect only student effort. C. Focus exclusively on faculty performance reviews. D. Discontinue evaluation after first-year results. 24. In adult learning, relevance is essential. Which NAVLE prep strategy applies this principle? A. Linking study sessions to likely exam case presentations. E. Using abstract theory with no clinical connection. C. Mandating uniform memorization for all learners. D. Ignoring candidate specialties in study plans. 25. Which mentoring technique most effectively fosters resilience in NAVLE candidates? A. Encouraging reflection on setbacks as learning opportunities. B. Discouraging discussion of difficulties. C. Minimizing feedback during failures. D. Focusing only on content mastery, not coping strategies. 26. When building NAVLE curriculum, spiral learning is best demonstrated by A. Revisiting concepts at increasing complexity across modules. B. Covering a topic once and never returning. C. Focusing only on surface-level repetition. D. Avoiding integration between systems. 27. Which communication method most effectively supports peer collaboration during NAVLE group study? A. Structured case-based dialogue with rotating leadership. B. Silent individual reading without exchange. C. Instructor monologue without interaction. D. Random, unmoderated social conversation. 28. In NAVLE exam preparation, formative assessments are most useful because they A. Provide ongoing feedback to adjust study strategies. B. Are primarily used for final certification decisions. C. Eliminate the need for summative testing. D. Focus only on attendance. 29. Which approach best ensures ethical mentoring for NAVLE candidates? A. Establishing clear boundaries and confidentiality agreements. B. Sharing personal test scores as a comparison. C. Requiring mentees to adopt identical study methods. D. Encouraging dependence on mentor for all decisions. 30. Which adult learning strategy best supports NAVLE candidates balancing work and study? A. Offering asynchronous, self-paced online modules. B. Mandating daily 8-hour live sessions only. C. Ignoring scheduling conflicts. D. Providing no flexibility in format.